Roughly 70% of people will probably experience what we consider a severe trauma in their life. And we know that also people who are receiving behavioral health care, so those who have been identified as a client within a mental health care system, identify at a higher level. So at least 90% of those people will have experienced a trauma in their life. Now, just because you experience something traumatic does not mean that you will go on to develop PTSD. We know that of the people who do experience trauma, roughly 20% go on to develop PTSD symptomatology. What's interesting about that is that PTSD is a normal reaction to an abnormal event. It is your body responding to something that you are having trouble processing, that you did not think would happen or be possible in your life or for you. Understandably, there's a struggle to make sense of that experience. For that reason, sometimes there is great variation in what that looks like for folks. Some people may experience some post-traumatic stress, or what we consider post-traumatic symptoms that don't yet go on to meet the criteria for a quote unquote disorder or PTSD, and those resolve. So for many people, they may experience something that they deem traumatic, and several weeks after the event, the symptoms that tracked with it start to remit or fade away. That's what we usually see as part of a path of recovery. However, we know PTSD is a problem in recovery. So again, it's a natural response that your body puts forth, your body's alarm system, and then something gets in the way of that alarm system calming back down or recalibrating. For many people, it can be not having the luxury or ability or time to really process the event. You can imagine someone who is in a combat situation, or someone who might be in an unsafe environment or has a lot of other stressors in their life that may preclude them from taking time for themselves. Or if there are other internal variables like shame or fear that make it difficult to face the issue, which is often the case for so many of us, it's really hard to fully process the event. These symptoms hang around. And what that means is that if they hang around for long enough and they become severe enough, we can say that you are meeting criteria for a diagnosis of post-traumatic stress. And that is why we get PTSD, or post-traumatic stress disorder. A lot of people experience trauma. It's actually incredibly common, unfortunately. This is not even considering events that sometimes aren't counted as traumas when statisticians and researchers are undertaking these studies. So historically, trauma has been defined and contextualized as what we used to refer to as big T trauma, or a trauma that is a crash bang trauma, a big singular dramatic event that resulted in significant threat or definite injury or severe distress to you, or you learned of that happening to someone else or someone close to you, or you witnessed it secondhand. And this resulted in a lot of fear and hopelessness or horror. That understanding has fortunately changed over time and become more broad, so that there's an acknowledgement that trauma is subjective, and what might be traumatic for one person isn't necessarily traumatic for the next. It could be that there is a hugely stressful life event that for one person is very difficult to emotionally metabolize and make sense of. That might not be the same for someone else, but it is for them. There's no one definition of trauma that we use across the board for all people. Trauma is trauma, meaning that if it's traumatic for you, then that's significant. You may have experienced an event that resulted in your body responding in a protective way. Over time, these symptoms might not have faded. Part of the reason for that is if you're avoiding dealing with memories or reminders of the event, that can prevent you from adequately processing it, as well as some of the reasons we mentioned earlier. So when these symptoms hang around and they're at the intensity and the level we talked about, then we know we can say you have met criteria for PTSD. Given that not everybody that experiences a trauma will develop PTSD, that tells you that there is a huge number of people that have experienced trauma in their life. Now, even within that, we said 20% of people might go on to develop PTSD. That number is very underreported because, as we know, there are factors that affect what might make someone feel like they can seek care or report an event. So in reality, if we think about the number of people that have gone through something traumatic and might be experiencing PTSD, have dealt with it without seeking care, are actively experiencing it, or have already sought care and can say that they have had it in their treatment history and are on the other side of it, that number is significantly larger. We're talking about 44.7 million people who have that as something that they can say applies to them. Symptoms that they experience might present themselves in different intensities or in different patterns in clusters. But in general, most people are going to experience some combination of re-experiencing the event. This might look like flashbacks, where it feels like it's happening again and you have trouble discerning reality from the historical event. It could be nightmares. It could also be intrusive thoughts or memories about the event that you experience as extremely unwanted and distressing. The other thing that would be a clue that you're struggling with this would be avoidance. Avoidance is what we call the glue of PTSD. So if you're avoiding dealing with the memories or reminders of the event, it's going to make it really hard for your mind to process what happened and make it make sense. And you can almost think about that like Tetris or a computer defragging, those shapes trying to slam down and fit into place. Until you really face it and address it, you're going to have a big stack of jagged pieces that are going to cause you problems and keep you stuck. If you notice that you might be avoiding reminders of the event that are literals, it could be people or places or things in your home that you have related to what happened, then that's a strong clue. But sometimes it can be a little sneakier than that, and it can be something that we have generalized in a broader way. So for example, if we are in a concert and the crowd surges and we get really scared, or maybe unfortunately we're involved in an event when something really bad happened in the crowd, maybe we fell down and we got injured and that was terrifying for us, we're going to make an association in our mind between the variables in that moment and danger, which is understandable, and it's what your body is doing to try to protect you. But you're going to associate that crowd with risk and pain and danger. But if you don't process what happened and work through it, and you keep avoiding it, sometimes that bleeds outward, and you might find that you're associating crowds in general with danger. And maybe over time, people with danger. With avoidance, it's a very sneaky thing because it can be subtle and slow, but before you know it, you'll realize that your world starts to shrink down. And the more it shrinks, the less social support you also have, which is really difficult because, as we know, social support is a big piece of our emotional health. Avoidance is a strong clue that you might be struggling. In addition to re-experiencing and avoidance, another area you may notice are negative changes in cognition and mood. If you're struggling with feeling down about yourself or other people, you might feel numb. This can also mean you're going to have problems in your relationships. Those are big areas to pay attention to following a traumatic event. A final area that you would really want to be mindful of would be noticing increases in irritability or anger. That's not to say that you can't get angry or irritable at things that go on in your day-to-day, but this would be a marked change from your pre-trauma experience. For example, you might get feedback from the people in your social circles telling you that you seem really tightly strung or easy to anger. You may also notice that it's difficult to concentrate and that you might be paying a lot of extra attention to the area around you and checking things like exits and wanting to sit with your back facing the room so that you can scan. It's also going to negatively affect your ability to fall asleep because you feel like you're wired and on all the time and you want to be ready for things. At Breda, we use guidelines as recommended by the VA and DoD and the American Psychological Association that tell us what treatments are most effective at addressing PTSD. We know this from a lot of randomized controlled trials or really big studies that look at how treatments might work with different types of trauma and different types of people. We know those treatments work. Those guidelines tell us that there's an area of overlap where both sets of guidelines recommend the same thing as highly recommended or strongly recommended. So you can rest assured that at Breda, you are receiving the highest caliber of care for PTSD. So what are those? Within that section of the guidelines, that would be cognitive behavioral therapy, cognitive processing therapy, or prolonged exposure. What's interesting to note there is that those are all forms of therapy that basically help you look at how your thinking changes after what you go through. When you go through a traumatic event, we find that our thinking changes in very specific ways. We can have negative thoughts about ourselves or other people or the world. We also note that those are usually in certain areas thematically, areas of safety, trust, power and control, esteem, and intimacy. There are very concrete skills that we can teach you to identify what those problematic thoughts are that are getting in your way and what you can do about them. How do you address those? How do you relate to those differently and develop new ways of thinking about the experience and the world in general and yourself and your relationships? All of those therapies that I mentioned can do that. The difference is with cognitive behavioral therapy or cognitive therapy, those are both therapies that are designed to help you look at your thinking or your thinking and behavior. You can apply those to what you went through. CPT or cognitive processing therapy or PE, prolonged exposure therapy, are forms of cognitive behavioral therapy. They are those same things we just talked about, boiled down and distilled into what we call a protocol or a little guide that tells you exactly what to do when. So you may have had experiences in the past or heard people talk about experiences where they went to therapy and their therapist was great, but it felt we just talked for a while and it was really open-ended. This is a little bit different from that, and that we have a guide for what we'll be doing. A lot of our clients really appreciate this because it gives them a clear, transparent sense of where we're going to head, how we'll know that we've reached it, and what that will look like. We really appreciate that from a trauma-informed perspective so that our clients can make an informed decision about their care. We say, here are the treatments that we know work best for PTSD, and we work with them to pick what feels right for them based on their personal variables and goals. Our preferred treatment is cognitive processing for PTSD, or CPT. We know that this treatment is highly effective. What's wonderful about this is more recently studies have been done that tell us that it can be provided in masked form or in intensive style. So you might be able to have multiple sessions per week if you're traveling and only going to be available for a short amount of time, or if your professional life necessitates that you receive treatment in a narrow time frame. The benefit to that is that we know from research on CPT and treatment outcomes that actually is even more effective than spreading it out further. CPT can be adjusted to fit your Cognitive processing therapy helps you look at how your thinking changes in 5 thematic areas: safety, trust, power and control, esteem, and intimacy. It also helps you look at what you went through and process through that using an element of exposure therapy by writing a trauma account. This is done in a really organized way, in a paced fashion with your provider. Everyone that we work with on this endeavor finds that on the other side of it, they experience a lot of pride in themselves and a lot of compassion for what they went through by being able to put it in context in writing. There's a very important element in that treatment that helps you write out what you went through and process through it. However, that is optional. Research on CPT tells us that the trauma account component can be waived if that's not right for anyone individually. The other elements of it, which involve the cognitive behavioral therapy skills and tools and helping you work through those thematic areas, is still highly effective in reducing PTSD. The majority of clients find that when they complete treatment, they no longer meet criteria for PTSD. Cognitive processing therapy or prolonged exposure therapy are both around 12 sessions in length. You'll need to commit to therapy, which is really helpful as well. More than just therapy. Therapy occurs for 1 hour a week, and your life occurs outside of that. We are aware. We always work with our clients to try to develop a holistic treatment plan. That's where a lot of the people in your circles and your self-care plan can come into play. Ensuring that you're connecting with people in your circles and utilizing your social support, your peer support is really important, not just because you might need them in times of difficulty, but also because that feedback might surprise you. Keeping our loved ones along with us through the therapy journey can be immensely supportive. Other things that can be useful in addressing PTSD would be things like mindfulness and grounding. We know research on PTSD treatment tells us that you don't necessarily need to delay treatment undertaking coping skills, but we can often incorporate these skills alongside the work that we're doing that is evidence-based so that you'll be able to use them and have them in your tool belt when you're outside of the therapy room. Mindfulness is something that lets you change your relationship to your emotions. It helps you stay in the present. A lot of times when we are feeling distress, we're thinking about something that hasn't happened yet, a fear or a worry, or we're really hung up on something that has already occurred in the past. You can't do anything about either of those things because you're in the now. Returning to the present is one of the most powerful things you can do for yourself. You can practice mindfulness in lots of small ways. All it requires is paying attention to the present moment non-judgmentally. That can be challenging because our brain narrates everything and will chatter incessantly. Mindfulness doesn't mean that you don't have judgments. It means that you're trying to not be judgmental about the judgmental thoughts that you notice. It's simply taking deep breaths and being mindful of what that feels like in your body. There are so many ways that you can integrate mindful activities in your day that can help anchor you in the present. It could be mindful exercise, mindful walking, noticing the way your foot makes contact with the ground every time you take a step. It could be mindful eating, noticing the way that an orange tastes when you take the first bite, or the way your coffee tastes in the morning. Those little moments can add up and help you stay anchored. One thing that we teach a lot of our clients is something called grounding. It's just like it sounds. It helps ground you to the present moment. It's a really quick and easy technique, and no one knows you're doing it. So you could do it in a work meeting, you could do it in a grocery line, but you can also do it at home in comfort and privacy. It's so simple, it sounds like a children's game, but that's actually really handy because a lot of times when you need it, you want quick and easy, just like an escape plan posted near a door. You just want to know what to do easily in that moment of distress. And the more you practice it, the easier it is. So how do you ground yourself? This easy technique is called 3 things I hear, feel, and see. What you want to do is utilize sensory data to force your mind and body to engage with the present moment. The richer a description you can give yourself, the more your body will be interacting with the present. For example, you can notice what might be discernible in your environment. You might hear traffic outside your window. You might hear chattering in the next room. You might hear birds outside, but you're going to want to describe that to yourself. When it comes to feeling, you could notice the way that your feet make contact with the ground and the way the ground presses up against your feet. You can feel your body in the chair, and you might find something that has an interesting texture, like feel a blanket that's soft and fuzzy. Visually, look around your space and either pick one thing that you can describe in great detail if that environment lends itself to it. There is a difference between saying, I see a rug on the carpet versus I see a long rectangular aqua colored carpet with a short nap and a wave pattern. You can see how using your sensory data can be powerful. By the time you've Rolodex through these things using your internal voice, you've been present for a while. And it might not seem like much, but again, this adds up over time. PTSD is not exclusive to things like military service or combat. Historically, there has been an association in our society with that, which is understandable given the prevalence that our soldiers come home with this issue. However, what we know is that trauma has been around for as long as people have been around to experience it. Trauma is anything that you experience as physically or emotionally distressing that causes continued distress after the event. It's not necessarily an event that is a trauma, it's your experience of it. So someone might go through a combat experience and not find it as traumatic as someone else. They might not develop PTSD. Someone else might experience something like a fender bender and it can be traumatic. It doesn't mean that there's anything wrong with that. That has a lot more to do with the lens that it's filtered through. Everybody makes sense of the world differently based on what we call our internal blueprints. We have a sense of how things are. Sometimes you might hear this referred to as a just world mentality. We can have a sense that the world is one way, or good things happen to good people and bad things happen to bad people. When something happens to us that we deem to be outside the realm of what we thought possible, it's very difficult for our minds to fit that round peg into a square hole, and we're going to struggle with it.